Wouldn't you hate to fail registry over just a few questions? Do you know what the most common topic is that cause people to fail registry? It's not cardiac, it's not pediatrics, it's actually operations, and that's because we spend so little time in it. So today we're going to go into one of the biggest topics in operations, and that's the incident command system. Now, some providers see this as micromanaging, but it's really not. It's just unifying team goals. Imagine a football field full of professional football players, but they went onto the field with no play. It's not that their individual skills aren't right. It's just that they need to be organized and have a plan. And that's what the incident command system is. The incident command system used to confuse me. A lot of our employers say that the incident command system needs to be established on every single call. And that didn't make sense to me. When I get to a call like this, I don't need a finance officer or an operations officer. And then finally it dawned on me, and I came up with what I call the hat theory. So let's use this call as an example. Well, the IC is the person that's ultimately in charge of the call. In this scenario, we're going to make that you. As far as planning goes, it's covered. We got protocols and treatment plans, and the crew that responds, their operations are actually providing the medical care. Chances are you won't need to talk to the press on a call like this, but if you do, your organization probably has somebody dedicated to that position that you can refer them to. And as far as finance, you're wearing a finance hat. When you complete your PCR, that's submitted for billing, which helps reimburse the system for the services provided. You're going to be interacting with other organizations, law enforcement, maybe utilities, the hospital, but you act as a representative to your organization. So you're also wearing a liaison hat. And then while safety is everybody's responsibility, if you're in charge of the call, it's your responsibility to make sure the call and all the responders are responding as safely as possible. And then there's logistics, right? Those are the people who get us the resources. Everybody has that guy. Well, logistics is that guy. If you need a tow truck, or if you needed the electric company to cut power to a line, logistics are the people that get you what you need. Now, in most organizations, dispatch plays the role of logistics officer, but you're speaking to logistics. So in a sense, you're wearing a logistics hat as well. Now, on a call like this, you can wear all those hats. We do every day. It's not a big deal. But what about a call like this? Well, all of a sudden, those hats would start to get heavy. Planning and treatment plans get more complicated. Obviously, operations gets more complicated. The press is probably going to have some questions. And obviously, finance, liaison, safety, and logistics all become more difficult. And those hats that you're wearing on the other call, well, they're a lot heavier now. So what do? Well, we spread them out. That way, the incident commander can focus on just the call. And you can take a scene like this, and everybody can look at it through their lens. Safety can look at all the operations from a safety perspective. Logistics can look at the same call and focused on what the call needs. Think of working a cardiac arrest and how much smoother it works when you have one person that's committed to airway and two people that are committed to chest compressions, and one person committed to medication administration. Well, this is the same thing. It's just on a larger scale. A few quick terms that we need to go over. And obviously, ICS has a lot of terms, but you guys aren't going to want a 4-hour video. But we're going to narrow it down to the terms that tend to show up on National Registry. And that's span of control. That just says how many people you can effectively manage. Now, ideally, it's 5 people, but it depends on the complexity of the situation. For example, if you and your team were going around the neighborhood handing out flyers, well, you can manage more than 10 people in that situation. But something like the incident we were just looking at, well, managing 10 people would get very difficult. So your normal span of control is from 3 to 7, with optimal being 5. Once we start to manage more than 5 people, communication starts to break down. And we're going to talk about that a little bit later in the video. We have unity of command, and this is important going up and down. This means that everybody on scene only reports to one supervisor. And this is designed this way so that communication flows effectively up and down. Now, this isn't just about the bottom of the chart speaking to their supervisors. The supervisors need to realize this. Of mass casualties I've been part of, a big breakdown is the top bypassing the chain of command and communicating directly to the bottom. And this seems good on the surface, but it leaves a whole lot of people in the dark. So that unity of command requires you to communicate up and down that chain of command to only one supervisor. Incident action plan, just like any call you go on to, you start to develop a plan of what we're going to do and how we're going to fix it. Well, the incident action plan is the same thing, it's just on a larger scale. Now, divisions and groups are basically the same thing with one caveat. Divisions are set up by geography. So if you were in charge of the north side of a scene, well, that would be a division. And groups are set up by tasks. So if you were in charge of triage, that would be a triage group. And we have strike teams and task force. Strike teams are just all the same resources working together as a team. And a task force is a mix of resources. So like an ambulance, a fire engine, and law enforcement component. That would be an example of a task force. And then resource. In incident command, a resource is considered one unit. That could be an individual person or that could be a team. So for example, if you were called to a scene and assigned as triage officer, well, you as an individual would be one resource. But if they needed an ambulance, well, then you, your partner, and your ambulance would be considered one resource. Now, with all that out of the way, let's look at the number one question that comes up involving the system on National Registry. The command staff and the general staff. This gets so many students. So let's talk about how it works and how it's titled. So the incident commander has 3 people that works with him or her directly. And there's a reason they work with them directly. The first is the PIO. This is the public information officer, the person that's going to speak to the press. Well, we all remember the telephone game in kindergarten. If you're an incident commander and you want to get a message out to the press, you don't want that message filtering through several people. You want to speak directly to the person that's going to be speaking to the press so that nothing's lost in translation. And the liaison works directly with the incident commander for the same reason. See, the liaison is the person that speaks on behalf of your organization to other organizations. And then there's safety, and it's obvious what the safety officer is in charge of, but all the plans that are coming down from the incident commander get filtered through the safety officer to make sure that it's conducive with a safe scene. And on the other hand, if the safety officer or one of his designees need to shut down an operation, that message needs to make it to the incident commander as quickly as possible. Now, these are the only components of the command staff, and that's where people get tripped up on registry. So you have the incident commander, the PIO, the liaison, and the safety officer. Everybody below that is considered the general staff. Now, there's an acronym for this is normally CFLOP. The general staff is comprised of a finance officer who's recording the expenses and all the money associated with the call. And there's logistics. Think of all the things providers would need for a long-term scene. So they would need a first aid station, which would fall under logistics, bathrooms, food, and whatever tools and equipment they need to perform their job. This would all funnel through the logistics officer. And then we have where most of the people watching this video are going to end up, and that's operations. That's like actual boots on the ground. Think of something like the Boston bombing. Operations can get complex because it's not just an EMS component. You have a fire component, an EMS component, a law enforcement component, a hazmat component. It can expand on, and as long as it stays within that span of control we talked about earlier, well, it can continue expanding or contracting depending on the size of the incident. On a 2-car MVA, you're the operations officer. And we'll break down operations a little bit more, but let's talk about that other component of the general staff, which is planning. Now, this seems like kind of a lame position, but mass casualties I've been part of, at least the long-term ones, planning has a role in everything. They're the stitch that holds all this together. They're making sure that operations is getting what they need from logistics. They also make sure that every component is working off of the same incident action plan that the incident commander sent out. But let's dig into operations. Like I said before, on a large scale incidents, a lot of times you'll have a lot of different operations. It's not just EMS. You might have a staging, you have fire, and then under fire, you're going to have hazmat and extrication and suppression. And then you have the EMS or the medical branch. And typically under that EMS branch, you have triage, treatment, and transport. Again, on a smaller incident, this might all be one person. But as the scene expands, we have to start handing out those hats. Let's pretend that your treatment officer starts calling for more staffing or more resources because of the amount of patients assigned to his or her group. Well, eventually this number is going to start to grow and we're going to get outside of that span of control. So what happens next? The beauty of the incident command system is that it can expand and contract as needed. So now it gets broken down into group 1 and group 2, and under each of those group supervisors are providers. So now we've brought that span of control back to a manageable number. And if operations change or something changes and it comes down from incident command, the EMS or medical branch director is going to tell the triage, treatment, and transport officer, and then they're going to tell their group supervisors. And if a group supervisor has a problem or needs a certain resource, he's going to tell the treatment officer, who's going to tell the medical branch director, and that information is going to flow up to where all the right people know what's going on. Now, obviously, we can make this video a lot longer, but I wanted everybody to know the topics that my students bring back to me from National Registry. And now you're ready for any ICS question National Registry is going to throw at you. Now, for a daily breakdown like this, check us out at Sip and Scan. But until next time, like, subscribe, and be safe.